Hello, everyone. It's December the 9th, Wednesday. All of us know that we've had an upheaval, I guess, of not real great news, to say the very least. Yesterday, came across all of our wire services, or the day before, really, about our great general, General Yeager that was a patriot beyond all comparison. At the same time, we were going through funeral services for a hero that we lost right here in our own city of Charleston, Cassie Johnson. And in addition to that, if that's not enough, and I'll get to it in just a few minutes, we had an explosion at one of our chemical plants last night, and we have people injured, and we're surely hoping and praying that they're going to be okay. Now, with all that, we have had 59 additional deaths since Monday. It's unbelievable. I'm going to read every one. The 842nd death, an 85-year-old female from Hancock County. The 843rd death, a 77-year-old male from Mason County. The 844th death, a 59-year-old female from Marshall County. The 845th death, a 62-year-old male from Lincoln County. The 846th death, a 90-year-old female from Boone County. The 847th death, a 95-year-old female from Hancock County. The 848th death, a 76-year-old female from Cabell County. The 849th death, a 54-year-old female from Cabell County. The 850th death, an 81-year-old female from Kanawha County. The 851st death, a 65-year-old male from Randolph County. The 852nd death, a 92-year-old male from Kanawha County. The 853rd death, a 72-year-old male from Berkeley County. The 854th death, a 97-year-old female from Greenbrier County. The 855th death, a 90-year-old female from Greenbrier County. The 856th death, a 97-year-old female from Greenbrier County. The 857th death, a 67-year-old male from Mingo County. The 858th death, a 96-year-old male from Marshall County. The 859th death, a 74-year-old female from Jefferson County. The 860th death, an 81-year-old female from Putnam County. The 861st death, a 70-year-old female from Fayette County. The 862nd death, a 93-year-old female from Kanawha County. The 863rd death, a 53-year-old female from Grant County. The 864th death, an 80-year-old female from Putnam County. The 865th death, a 78-year-old female from Hancock County. The 866th death, a 75-year-old male from Raleigh County. The 867th death, an 86-year-old male from Kanawha County. The 868th death, an 89-year-old male from Wood County. The 869th death, a 62-year-old female from Harrison County. The 870th death, a 65-year-old male from Cabell County. The 871st death, an 83-year-old male from Wayne County. The 872nd death, 72nd death, an 87-year-old female from Berkeley County. The 873rd death, a 76-year-old male from Berkeley County. The 874th death, a 70-year-old male from Berkeley County. The 875th death, an 81-year-old male from Wyoming County. The 876th death, a 79-year-old female from Mineral County. The 877th death, a 54-year-old male from Mineral County. The 878th death, a 64-year-old male from Mineral County. The 879th death, an 83-year-old female from Mineral County. And just because I may have just skipped over something, skipped one here, let me go back. The 877th death, a 54-year-old male from Mineral County. The 878th death, a 64-year-old male from Mineral County. The 879th death, an 83-year-old female from Mineral County. The 880th death, a 94-year-old female from Mineral County. The 881st death, a 64-year-old female from Mineral County. The 882nd death, a 76-year-old male from Kanawha County. The 883rd death, a 59-year-old female from Ohio County. The 884th death, an 89-year-old male from Ohio County. The 885th death, an 85-year-old male from Ohio County. The 886th death, a 90-year-old male from Kanawha County. The 887th death, a 74-year-old female from Marshall County. The 888th death, a 71-year-old female from Berkeley County. The 889th death, a 49-year-old male from Mercer County. The 890th death, an 87-year-old female from Gilmer County. The 891st death, an 89-year-old female from Putnam County. The 892nd death, an 80-year-old male from Putnam County. The 893rd death, a 72-year-old male from Wood County. The 894th death, a 59-year-old male from Wood County. The 895th death, an 88-year-old male from Hancock County. The 896th death, a 73-year-old male from Hardy County. The 897th death, a 90-year-old female from Mercer County. The 898th death, a 65-year-old male from Mercer County. The 899th death, an 88-year-old male from Mercer County. The 900th death, a 74-year-old female from Ritchie County. The 901st death, a 78-year-old male from Wood County. You know, it was just yesterday almost when we had no positive cases in the state of West Virginia. And then all of a sudden we had our first positive case. And then all of a sudden we had our first death. And we had our first death. When we had our first death, it was a big deal in the news almost. It's a big deal, period. I'll never forget Clay Marsh. We were doing a show with Mark Curtis. And at the time, we were just discussing everything that was going on with COVID and all the different stuff. And we were warning people about what they were going to have to do. And we were having to close things and whatever it may be. And at that point in time, at that show, the number of positives in West Virginia jumped from 2 to 4. And Clay Marsh looked right at me and he said, "Governor, it's going now. It's going in our state right now." Well, we hoped and prayed like crazy that we could probably have never even comprehended that we'd see a day in the state of West Virginia where we'd lose, or 2 days rather, we would lose 59 people. You know, for a long time, there was some reporting station or whatever in Washington State that predicted West Virginia would lose 74 people with this. And I really continued to hope and pray like crazy that we wouldn't get anywhere close to that. Well, we've almost lost that many in the last 2 days. You know, this terrible killer is all across everywhere. Nobody can really identify and say, you know, if we would do this at the school, if we would do this at a bar, if we would do this at the Mountaineer Challenge Academy, if we would do this, you know, at our restaurant, if we would do this in Monongahelia County or this in Raleigh County, it would slow this thing and really make an impact. The truth is really simple, West Virginia, and it's just this. You're doing good in lots and lots of ways, but this killer is all amongst us everywhere, everywhere. It's everywhere. And we're all being attacked in every way. So what do? We do the next best thing that we can possibly do. We wear a mask. We wash our hands. We stay social distance. If you're elderly, you try like crazy to absolutely not get yourself exposed. And you know what we do? We sit and we hope and we pray and we wait on our health experts that are such professionals beyond belief to come to our rescue, as we do all the time. As we do all the time. You know, God forbid we have a heart attack, we have cancer, well, no matter what it may be, we sit and we wait on our health community to come through for us with, first and foremost, a blessing from God. I truly believe God is in complete command all the time. He'll get us through this. But right now, He expects us to work too. He expects us to do the best we possibly can. You know, there was that old story a long time ago, you know, about the guy that was, you know, standing right below or living right below a dam, and the water had been raining like crazy, and everybody said to him, you got to leave, you got to leave, you got to leave now. And he said, no, 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 no. I'm fine. The good Lord's going to take care of me. Well, so the park rangers that had visited him and everything, you know, they couldn't talk him into leaving. So the water kept coming up. And all of a sudden now the only way they could get to his house was a boat. And so back to, you know, the rescue people back to the house with a boat and said, please jump on, please. No, no, no. I'm going to stay right here. The good Lord's going to take care of me. Well, all of a sudden the water just kept coming up. And now the man's on a roof, his roof. And the only way they can get to him is with a helicopter. And so now you've got the National Guard or whoever it may be in a helicopter and touching down with one of the skids on the edge of the roof and saying, grab a hold of this line, grab a hold of this line. He says, no, 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 no. The good Lord's going to take care of me. Well, the water kept coming up and the man drowned. And as the man was entering the pearly gates of heaven, per the story, he says he looked at the Lord and said, Lord, I stayed there because I knew you were going to take care of me. And why did you let me drown? And he said, I tried to take care of you 3 times. I sent the park ranger, I sent the boat, I sent the helicopter. We've all got to do a little bit ourselves. We have the ability to have our mask. We have the ability to do our testing. We have the great experts bringing us a vaccine. The good Lord is in complete command, complete command. But we got to do our parts too. Our number of positive tests in the last 24 hours, remember when I said we jumped from 2 to 4, and Clay Marsh looked at me and said, it's really going now. 2 to 4. Yesterday we had, in the last 24 hours, we had 1,402 new positive tests. Our daily positivity rating was at 6.59. Our cumulative is now close to 4%. It's 3.95. Our active cases are over 20,000. Our recovered cases are at 37,500. We now are back to a record high hospitalized patients of 650 and 180 in the ICU units. Yesterday we tested over 13,000 in West Virginia, which is really good. Our RT rating in West Virginia jumped from, I think, 1.06 to 1.13. It doesn't seem like much, but when it jumps like that, now we are the 10th worst in the country. We have 14 counties in the red, 22 counties in the orange. Everything remains on the table. Everything remains just waiting for people to tell me this is absolutely going to really help. And the vaccine is within days now, days of starting. Let me give you a little bit of an update on the vaccine. The FDA is scheduled to have an all-day regulatory meeting tomorrow where it is expected that they will discuss the emergency use authorization for Pfizer. FDA officials have said they plan to make a decision on approving this emergency authorization within 4 days of the meeting. I hope to the good Lord above that they approve it faster than that. The federal government tells us within 24 hours of receiving the FDA approval, West Virginia will begin receiving shipments of the vaccine. So once they approve, within 24 hours, we'll have the vaccine in West Virginia. Within 24 hours of receiving the vaccine, we'll be vaccinating people. I'll continue to update you on each part and each and everything that happens. Today, I'm also happy to report that we have received a total allocation increase in the number of doses of the Moderna vaccine. We now expect to receive 32,000 doses of Moderna. That's up from 26,000 last week. So, our screams and our cries and everything else are working as far as moving the number and bumping us up with more and more and more vaccines. Just some vaccine reminders. COVID-19 vaccine will protect us from this virus, and it will save lives. You know, the clinical trials were done with tens and tens of thousands of people. The side effects, very, very minuscule. You cannot get COVID from taking these vaccines. You have to take 2 doses to be completely protected, but they're finding out with the first dose, there's going to be some level of additional protection. You know, again, until you and the people who live in this great state or live with you are vaccinated, the absolute best defense you have is that mask, washing your hands, doing all the stuff that we just tell you over and over and over that you got to do. There's no point in me going through the face covering modification to where we made it mandatory in public buildings. You know, I would just say this to all those out there. You know, there was, and I'm going to mess this up, but, you know, we as private citizens don't necessarily have rights that enable us to do things that endanger the public or do things in public buildings, you know, that endanger our fellow man. And the perfect example of that is driving a car drunk. You know, if you think it's your right to be able to drive a car drunk, you know, then you need to explain that to the law enforcement people. You know, really and truly, in this situation, we all know, every single one of us know to the very best of all of our abilities that if you're driving a car drunk, you're probably going to have an accident. And if you're walking around without a mask and everything else, there's a good chance that you could be infecting others or you're going to get sick yourself. You know, it's just that simple. You know, all of our testing stuff's up on the website. You know, we encourage you, go get tested. The more we test, the more we'll know, the more these spreaders we stop. You know, I mean, if we hadn't done this massive amount of testing, gracious sakes, who knows where we'd be right now. You know, I commend the drive-through pharmacy people for all they're doing. We have 18 total outbreaks in our schools now. We're down to 66 confirmed cases in the public school system. Now think about that. In our schools today, I think we've got right at 220,000 students and about 40,000 service personnel and teachers. We got 66 confirmed cases. A lot of good work is being done there. A lot of good work by our Department of Ed, by our teachers, by the service personnel. A lot of good work by our kids and their families and their parents. In long-term care facilities, we have 116 outbreaks. We have 20 outbreaks now in 13 counties in our churches. Those are Berkeley, Braxton, Cabell, Fayette, Harrison, Marion, Mineral, Mingo, Nicholas, Raleigh, Taylor, Webster, and Wyoming counties. Over and over, I go through the same thing. Biggest thing I could possibly do is tell you this. If you're older than 65 years of age, and really and truly you have some form of chronic, illnesses, diabetes, lung issues, whatever it may be, I truly believe with all my soul that the good Lord would want you to get your church services from, online or something like that. He would want you to reach out and try to protect yourself as best you can until he can get us these vaccines and really take care of us. In corrections, now we've jumped to 321 active inmate cases. The Northern Correctional Facility and adjoining regional jail now account for 288 of the 321. I'm telling you, once it gets there, it goes. We have 78 active staff cases, and DCR, and I was incorrect about this the other day, now they have confirmed the 5th inmate death from COVID. And then that was a 54-year-old Mount Olive inmate who died on September the 13th at an outside hospital. And he also had underlying conditions. The flu vaccine's available to all. We want to push all of our cities and counties to get your applications in. We've got $214 million that's going out the door right now. We have bumped that allocation up to $225. We'll continue to look and possibly adjust that allocation if need be. We've got to have your stuff in and got to get it in now. Remember about blood, there's been a real push, from the Red Cross and lots of people. There's a way that you can really step up to the plate, especially if you've had this, you've got antibodies and all kinds of different things. You could really help by stepping forward and giving blood. We found out this morning WVU announced, that with DHHR, they've teamed up to create a new rapid development lab. I don't know, how this came about and everything, but nevertheless, we funded the lab. We funded the thing out of the CARES money. From what I understand, we did it a good while back. We've been waiting on it to become a reality and everything, but this is your CARES money at ACT right here, and so from the standpoint of the federal government and DHHR, great work, and WVU, you're doing good too, so thank you. Like I said, we lost a general. We lost a West Virginia superstar, but we lost an all-out American patriot beyond belief when we lost General Chuck Yeager. There's things within this state, like our great airport up here, that's named in his honor. But here was a guy, that really was from Myra in Lincoln County. A general that a lot of people tried to copy his mannerisms. A general that really was right to the point. I had the pleasure of meeting him on not many occasions, but on enough. He sat with me in my office and we talked an awful lot. This was way before I became the governor. I'll never get over how frank he was about things and how proud he was about how hard he had worked. He didn't just want to be known for the guy that took the most risk or the guy that had the most courage. He also wanted to be known for the guy that worked the hardest. The guy, one of the newscasts, I said, You know, my dad used to always say, don't confuse effort with accomplishment. He achieved. He achieved. He just didn't try hard. He worked hard in every aspect of his life. He brought so much notoriety to West Virginia, it's unbelievable. And absolutely, we lost an absolute hero beyond belief, 97 years old. It's amazing. Passed away on Monday night. Join Kathy and I in prayers for our great general and his family and all of his loved ones. I will be signing a proclamation to lower our flag statewide to half-staff in General Yeager's honor as soon as we know when his services will be announced. But nevertheless, we lost a real superstar right there. Okay, there's more. Last night we lit the lights on the, and this, you know, this was the idea of one of the people that works with me, and it was a great idea, and Cassie Johnson's honor and everything, to light up the mansion and light up the front of the Capitol and everything with blue lights. So we scheduled to do that right after dark. And you know, naturally I was here, we did it on the steps of the mansion, and when you could see the Capitol, the way it was lit up, it was both just beautiful. In honor, like I said, over and over, of a tragedy that just was plain unnecessary. You know, this pandemic, it came to us, for all that we know, from China. And if China would have opened their doors early on and let us come in, there's an awfully good chance we could have stopped an awful lot of this. You shouldn't ever forget our president canceling the flights from China and everything, and God knows that really, really, really helped slow this down. But in all fairness, last night, you know, we do that dedication to this beautiful, beautiful young lady that was representing us in our law enforcement in Charleston and our city police, and we lost her in a terrible tragedy. I called to her family yesterday morning and everything and asked for their permission to go ahead and do this, and they surely were super kind. And they said that Cassie would love that, and they know that she can see and she can be there and she'll see it. And I know that too. I know that in my heart too. And sometimes we have people leave this earth and we can't understand. We can't possibly know God's plans. We can't. But nevertheless, you know, then, you know, we ate a little bit and we talked about all kinds of different things. Then, you know, I went upstairs, went to bed, and then probably right at about 11 o'clock, maybe, I don't know, 10:45, the phone started ringing like crazy about a plant explosion at Bell at the Chemours plant there, and the first reports that we got, you know, were chlorine, and the first reports were not good. Immediately there was a 2-mile radius, you know, set in place, and then it just went on and on and on until that was lifted at 4:30 this morning. You know, yesterday was another really, really long day. And last night it turned into even a longer night. You know, when it really boils down to it, right now what we know is there's 4 people that are injured, and we know that the primary fire was methane, and they were going to, or methanol rather, and they were going to let that just burn itself out, and probably about midnight, you know, is when the fire was extinguished. Now, I want to read this right here. It says, and this is perfect, but the outcome could have been much worse if not for all the first responders, and get this part, who were trained and ready to respond to these types of incidences. They ran to the fire last night, and we can never thank them enough. It's good stuff. Good stuff. We're going to keep everybody there in our prayers too. Okay, in Greenbrier County last night, also, word came that we had a terrible tragedy that happened, you know, in the Williamsburg area in Greenbrier County. You know, that's out towards Trout Valley and Coal Knob and all back in there. You know, if you're coming into Greenbrier County from, you know, on the interstate, you know, and you're approaching the Lewisburg exit, probably 4 or 5 miles before you get to the Lewisburg exit, if you'll just gaze way, way, way off directly to the left, you know, or maybe even 8 miles before you get to the Lewisburg exit, 2 or 3 miles before you get to Alta and everything. That's way, way back there, probably 12 air miles is where Williamsburg is. You know, there were 9 volunteer fire departments that responded to this last night from Clintonville, Frankfort, Williamsburg, Lewisburg, Ronceverte, Tri-County, Smoot, Raynell, and Fairleigh. There was a fire. There was people that were supposedly trapped in the fire. So far, there's been 4 bodies that have been located and removed from the home, which was totally destroyed, and a 5th body that's been found outside the home, and they're still looking for a possible 6th body. You know, 3 of the kids in the house were a 2nd grader, a kindergartner, and a pre-K child. You know, investigators have developed a timeline and sequence of events leading up to the deaths. The investigation is continuing as evidence at the scene is being examined and processed. Specific details of the investigation, including the manner and cause of death, will not be released or will not be released pending confirmation by the state medical examiner. The Greenbrier County Sheriff is coordinating the investigation. Tough stuff. The only other thing I think that I've got is, let me see. Yeah, I've been through the reminder about being 65 years of age. I can tell you that we have people, you know, in all kinds of age demographic that are, you know, testing positive. We've got to really just buckle up. The only other thing that I want to do is, you know, I know our Attorney General is suffering and recovering, you know, from COVID and you know, where he was, you know, announced and tested positive, and Kathy and I are surely praying for Patrick and his family and that he'll have a really quick and speedy recovery. But at the same time, I know he's continuing to work, and I know that he's working on an issue that the president called me about, and it is just this. Basically, the long and the short of it is, you know, the possibility of us entering suit or entering the suit, you know, in which basically West Virginia is saying, you know, that we want our rights, you know, exercised from the standpoint of how the votes were counted and everything. We handled ourselves exactly how it should have been handled here in this state, and we absolutely, overwhelmingly voted for President Trump, and we want President Trump to be able to have his due. And I don't know exactly where the Attorney General is on that, but I would surely encourage only from the standpoint of just doing this. I don't know the particulars. I'm not a lawyer. I'm not our Attorney General, and at the end of the day, I'm sure our Attorney General will make the right moves, and I'll support what he comes up with and everything. But you know, I would be supportive if that's his decision, and if his decision is this is not proper or not right and everything, then we support his decision. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I want to reinforce and add a couple things to what the governor said. First of all, I want to thank the governor and the investment of the CARES funding from my colleagues at WVU, who have created this rapid development laboratory, which has really been developed to respond to the greatest needs of our state. And in this way, to augment the ability for us to test for COVID-19, to do it in a rapid manner, and to work to reduce the price of each test. The CARES funding that was invested in this effort has been successful. The laboratory is doing over 500 tests a day, and soon we'll be able to do up to 1,000. So ultimately, this is the kind of investment that really does pay dividends for the state of West Virginia. And we believe this is a great platform investment to continue to develop solutions for public health and population health, even when, God willing, we have COVID behind us. The governor reported today a large number of deaths, and as we assess it, and General Hoyer confirmed that this is the highest two-day death total that we've had so far in the COVID pandemic. And I think it's really important to realize that in the United States, we've passed 15 million cases now of COVID-19. It took 100 days to get the first million cases in the US. It took an additional 44 days to get the second million cases. Well, the most recent million cases to get us to 15 million happened in 5 days. And so we are averaging close to 200,000 Americans a day being diagnosed with COVID-19. As the governor pointed out, we have more people in hospitals in the United States and in West Virginia than ever before. And we are seeing more people die of COVID-19. At least we did in each of a 2-day period last week than we've ever seen before. And we're not saying this to scare people, but it is important that each one of us in West Virginia understand the gravity of the situation and the opportunity for us to impact this in a very positive way. And the governor has pointed out that wearing a mask and physically distancing is truly a game-changing intervention that we each can do. And I posted the other day a report that was on National Public Radio on social media. And that report really did start to look at the evidence for wearing a mask. And it's really important. And I think this is something that maybe we haven't stressed enough, that it's not only important to wear a mask to reduce your risk of generating droplets and aerosols that can infect other people. But in fact, it's been recently shown by you wearing a mask, even if you're around somebody with COVID-19, it tends to reduce the severity of COVID-19 for the recipient, and it tends to protect you from other people as well. So even more reason to wear a mask, which is a really simple intervention. And although the governor has gone into great detail, as have I, as have others, so I won't go back through it, but it is really such a powerful treatment and prevention measure against COVID-19 that we really want people to realize that this is a powerful tool in all of our tool belt if we use it. And if we use it, it's really effective. If we don't, it's not. And we want at least 70% of people, 80% better, 90% best of people to wear that in environments. And therefore, that should reduce the spread of COVID-19 to what we'll see with the vaccine. As the governor said, the Pfizer vaccine is about to undergo the assessment, and we believe that will lead to emergency use authorization. As people know that the vaccine is now being used in the United Kingdom, and people are starting to get injected. We continue to see the briefing document for the FDA, the Food and Drug Administration, that are assessing this. And overall, these vaccines, as a class, the Pfizer vaccine, we've seen that information, and Moderna will come, but these vaccines appear to be very, very safe, and they're incredibly effective. So this is something that we are very enthusiastic to bring to our state. And my last comment is I just really want to thank the National Guard, General Hoyer, Lieutenant Colonel Joe Peel, and others who are really creating this, and also our joint interagency task force that is working on this from a number of industry sectors as well as our military leadership to be able to create a distribution plan that will get all of the vaccines to the West Virginians that need to be vaccinated first. And we'll do this successfully so that we don't waste a dose of the vaccine, and that we're able to navigate an incredibly complex operation. So we're so lucky to have these great leaders in the state of West Virginia, and I just wanted to express my gratitude for them. Governor, that's all I have today.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. I want to highlight a couple of other items that we're working on in addition to vaccine distribution. We have some additional National Guard personnel supporting DHHR, local health departments with remote case investigation, contact tracing. They're increasing significantly the capacity to address those needs. I want to actually point out from them that one of the concerns that they have is we need all people to provide all the contacts they've had to make sure that we can effectively mitigate the spread of the virus. Another important mission going on right now is working with key nursing home and assisted living facilities to put up negative pressure areas as well as additional barriers to mitigate the spread. They're working with Dr. Amjad and the strike team that we have working with our nursing home facilities. As the governor pointed out, his direction to us is to continue to focus on being ready and prepared to receive and execute vaccine distribution as soon as the decision is made. So we continue to work aggressively on that with a number of partners. Tomorrow, we will have what we call a rock drill, in military terms, a rehearsal of concept, where we will walk through with all the key players the things that we need to do to make sure we have all the activities and support in place to conduct that distribution as soon as possible. Please, again, as the governor has pointed out on multiple times, as has Dr. Marsh and others, while we are waiting on the vaccine and while we get the vaccine distribution into place, we still have months of time before all individuals are vaccinated. So please heed the governor's direction that we've got to continue to mask. We've got to continue to do those things to mitigate the spread going forward. Thank you.
Thank you, General. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I just want to highlight a few things, and do want to thank the governor for leading us for these past 9 months in the pandemic efforts. We've done really well in West Virginia, but we do need the public's help with our contact tracing efforts. Our epidemiology team has noticed a decrease in our contact tracing efforts, and this is a time that we ask the public to answer their phones and provide us the information with their contacts. It is important to identify the people that you've been around in order for us to decrease the transmission that we're seeing throughout the state. We do realize that people do not want to possibly isolate, get tested due to reasons that they need to go to work, but it is important to decrease the transmission that we're seeing. There are ways to get tested earlier, to possibly find ways to mitigate the spread, but we do want to encourage folks to answer their phones, to identify themselves, and participate in our contact tracing. That is the only way to stop the spread. But also wear your mask, limit the times you need to go outside, and participate in contact tracing. That is very important. Thank you.
All right, thank you, Dr. Amjad. Bill Crouch, Secretary of the West Virginia DHHR, had a prior engagement today, and he will join us again on Friday. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. Governor, I was with Delegate Doug Scaff this morning, a Democrat. He is now the House Minority Leader in the House of Delegates. He again is calling on you to call a special session of the legislature to, if Congress is not quick in allocating more money for the states are going to have to come up with their own money. And he thinks it would be wise for you to call the legislature into session. I know I've asked you about it the last couple of briefings. Any new developments in that regard?
Mark, I haven't been contacted, or I don't know that my office has been contacted by this delegate and everything, and it's great that he's talking to you and suggesting a special session. But you know, it'd be nice if he'd talk to us. But we'll do it absolutely as if need be. You know, the bottom line, you know, is Congress is working on this every day, and we hope to God above that Washington can get their act together from the standpoint of all those that are there and make a decision that I've been screaming to the highest hills about till I'm blue-green, as I say all the time. But Congress has got to act in everything. You know, from the standpoint of, do I think they're going to act immediately and everything? Surely to God above, before they traipse off and everything on recess and everything, that they're going to act. And even McConnell, it came out and said, well, we're not going to adjourn until we get something done. Well, that sounds great. You know, I'm glad he's come out and said that. That's great and everything. But really, what he's doing is just playing another card, you know, from the standpoint of saying, you know, we're going to adjourn. You know, they're just not, I mean, you know me, I just tell it like it is. What do you think the chances are of our Congress staying in session and not adjourning for Christmas? I mean, do you think there's any chance of that? I don't. And so if I don't, then they're not going to adjourn until they get a deal done, so they're going to have a deal done. You know, but I stand open to any level of special session. You know, look, Mark, if everyone will just step back and be fair from the very first day to where we stand today, how we have navigated through this from an economic standpoint. Now, I'm not going to sit here and toot my horn in any way, but from an economic standpoint, Mark, we could have absolutely derailed 50,000 different ways. We have absolutely navigated through the wisdom of the revenue people, our office, all the input that I could throw into this thing. We navigated through with the 2020 year with a surplus, with moving our tax filing date, and with COVID blasting us right between the eyes. A surplus. And then we have navigated through this CARES money and how to handle it and how to absolutely not put our businesses at jeopardy, that we would have to jack their taxes out of sight because we didn't have the unemployment dollars in an unemployment fund and everything to be able to handle that. But we did it, didn't we, Mark? We did it. And basically the rate could even go down. But if we had stubbed our toe in the wrong way, we would have absolutely had to go back and taxed our businesses in a time when they would have been hurting the very, very most. And we've done all that, and along the way, lots of other things, like when the president came out and said we're going to give $400 to all the, a week to those that are unemployed and everything, but this federal government's only going to really do 300. The states can do 100 if they choose to. And there was maybe a very, very handful of those that said that they'll do it. We stepped up and did it. It cost us $38 million, but we did it. And we did it to help our people. Now, it's great, and I love input. And I don't need to get passionate about this, but I am telling you, just to stand out on a street corner and say, let's do this, and let's do this, and let's do this, and ignore what has been achieved, that's not very fair. That's just not fair. I'm telling you, we're going to get this stimulus package passed, and if we need a special session, we'll call a special session.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. With regard to the vaccine distribution, a lot of West Virginia's at-risk population does not live in a congregate setting, does not live in a nursing or a rehab. How is that going to work? Are they going to be targeted with special messaging to come in, get a vaccine to get to them? Also, a question about inmates in the state prisons. Will they be given any kind of priority to get the vaccine because they are in the custody of the state and they are in a congregate setting?
General Hoyer, this is you, sir.
Yes, sir, Governor. So, Paul, to your question, within the Joint Interagency Task Force that the governor established is what we call Joint Information Center. And it's the public affairs folks from multiple agencies under the direction of the governor's office. And what we do in that and will do is working with local health departments, providers, DHHR, and others, will target messaging to appropriate populations. As we pointed out before, governor's focus for us initially is on maintaining the integrity of our acute care health system and addressing that most significant threat we have in those nursing home settings and assisted living settings where 50% of our fatalities occur. We will also, as a group, be providing additional recommendations to the governor moving forward, as Dr. Marsh has talked about before, related to those over certain ages and with high health risks that we know are vulnerable populations. And we'll focus on those in an important manner going forward.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is probably best answered by Dr. Marsh. Both today and at previous press conferences, the governor has talked about how there's not enough evidence to support that some of the targeted shutdown measures we've talked about would be effective. Is that something you agree with, Dr. Marsh? And are there any steps you think we should be taking that we could implement? Thank you.
Dr. Marsh, I think, go ahead, sir.
Thank you, Governor, and thank you, Charles. You know, certainly the governor understands all of the information that we have at our disposal, and he's correct in the, you know, from the perspective that as we look at our outbreaks and we start to, you know, look at nursing home outbreaks and look at church outbreaks and look at school outbreaks, and then we look at transmission across those places and find that, you know, certainly we see transmission around nursing homes, we see transmission in churches. We don't see that much transmission in schools. And then we look at the places that we know from a national perspective, Charles, that there is an increased risk that the CDC reports in places like bars, indoor dining for restaurants, coffee shops, gyms. We can't really find, you know, specific outbreaks that say, oh, that, like, you know, we use this story a lot, but the bars in Morgantown, we were able to say really very certainly that they were a big reason why we were seeing spread, because we had a student population at WVU. And the governor's right. We can't find that level of data, and we are looking very hard. And I think that his perspective, and I'll certainly let him talk for himself, but his perspective is that because of the critical nature of, you know, small businesses and family-owned businesses with shutting things down, that could be a death knell to those businesses. And so he has really tasked us with looking as carefully as we possibly can to find those things where we could say with more certainty that if we do this, we will see a reduction in the spread of COVID-19. So we can rely on national information where, we know that people who don't have a acute contact with somebody who's been found to have COVID-19 are twice as likely to have gone and eaten in an indoor restaurant or a bar, gone to a coffee shop, gone to a gym, or worked in a place where they go around other people. And we know that indoor environments where people take off their masks are particularly concerning environments. So we do know that, and the governor is well aware of the information that's out there too. But I think from the standpoint of supporting these businesses and also keeping the state together, we've talked about how important that is, that we continue to search. And I know that he stands ready to act as we can provide that information to him. And that is an ongoing effort on our part to try to do exactly that. But so far, we've not been able to pinpoint that level of data. I hope that helps.
All right, thank you, Charles. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. I think this is a question for Dr. Marsh as well. Today, if I'm reading the data correctly, we have 1,400 new cases in the past couple of weeks. We've had well over 1,000, in consecutive days in a row. We're just a couple weeks out from Thanksgiving. I guess my question with the information that we have and the numbers that we're seeing is, have we made it past the peak of the Thanksgiving holiday and the cases that would arise from there? Is question number one. And question number two, what can we do to limit this, knowing that some people are still going to go out and spread the virus even after they've been confirmed positive, or maybe spreading the virus without knowing that they've got it? Thank you.
Doc, you can answer, or Dr. Amjad, or I'll go. But y'all go. I'm hoarse. So
okay.
One of y'all go.
Maybe I'll start, and then then you can go, and then Governor, certainly you can back cleanup for us or run the anchor for our relay here. Well, I think that your question, Dave, is a good one. We do see an increase in the number of West Virginians that are being found to be positive on a daily basis. The governor's pointed out that we are testing extensively, which we believe is a huge benefit to having at least some modicum of control of helping communities. But as the governor said earlier, we see more red counties now related to both percent positive and infection or incidence rates in these counties, and orange, over half of our state, I think now is red or orange. So we know this virus is spreading quickly in our communities. As we look at the Thanksgiving holiday, and I'll quote Anthony Fauci here, we know about 2 to 4 weeks after a larger contact is when we start to see people both who get sick with symptoms, go into hospitals, and people start to die. So he has said publicly that we have not seen the peak of the Thanksgiving holiday. And I think that's just projecting that particular set of data, the 2 to 4 week period. But the concern is that we may not have seen the peak here either. We'll have to see as time goes forward. But what we have talked about wearing masks and physically distancing becomes even more important, as the governor's pointed out, to try to break that chain of transmission, and particularly at this time as we're getting vaccines out. So with the Thanksgiving holiday perhaps not even peaking, and the December holidays, Christmas, Hanukkah, Kwanzaa, and whatever people celebrate, but that's a time for gathering. It does provide a very risky, situation for people here in West Virginia as far as transmission, and people in the U.S. And we really, really urge people to be very, very thoughtful and cautious in their usual sort of celebrations, and how big the celebrations and how they they protect themselves, particularly this year. Ina, I'll turn it over to you.
Dave, I do want to answer your question about people, going around and maybe spreading the virus and not knowing that they have it, because that is important, because people do need to live their lives and go about their daily business. That's why wearing a mask is very important, and social distancing. And I would encourage people to practice those two measures daily within their entire lives, because we don't know if we have the virus, and it is impossible to, maybe always get a test or always do things, because you do need to live your life. So that's why wearing a mask and socially distancing yourselves from people that you do not live with in your household is very important. And I would encourage people to live those two things daily, and to practice it as much as you can, because that is very important. And that's how I personally, practice every day. And that's what you need to do in order to stay as safe as possible. So that would be my recommendation. Thank you.
All right, thank you, Dave. Next, we'll go to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. Governor, you had mentioned the fire that occurred in Williamsburg yesterday. I did just want to mention quickly that that was actually the second residential fire that happened yesterday right there in that particular part of Greenbrier County. There was another fire yesterday morning in Asbury where unfortunately an 80-year-old woman was killed, and a lot of the same responders that were in Williamsburg last night were also there in Asbury yesterday morning. So they had a pretty tough day yesterday, and I just wanted to acknowledge that. But anyway, my question today is really more of an education question, so I may have to redirect it to Superintendent Birch's office, but I'll put it out there to you. A lot of schools across the state, be it individual buildings or complete county systems, are transitioning right now to remote learning, regardless of their color designation. From what I am hearing, a big reason for this is that in certain areas, the schools are seeing significant shortages in their faculty and their staff, and in their substitute faculty as well. I know obviously there have been a lot of different things done to try to mitigate the health risks associated with keeping the schools open for students and for staff. But has anything been looked at this point as far as maybe diverting some additional resources towards assisting the counties with their staffing levels so that they're able to keep the buildings open if their designation allows for that? Thank you.
Okay, was this Dave? Is that correct?
Matthew.
Matthew, I'm sorry. Okay, Matthew. First of all, let me comment on all those responders that I read off earlier. I think there was 9 different ones, and or 9 different agencies or whatever, or different groups of responders that responded to the fire in Greenbrier County. And I did not know about the Asbury situation. Of course, I was here all day, all night, everything yesterday. I did not know about Asbury, but let me tell you, if you really don't know what our great volunteers, our great police force, our great health and firemen, and all of the people that are around us, if you don't know the great work they do, you really ought to try to get involved at least enough to be able to recognize and appreciate what they go through. I mean, I'm telling you, these people are unbelievable, and a tremendous amount of them are volunteers. And you're dadgum right, they probably had a really tough day yesterday, but they've probably had a lot of tough days, and a lot of days that we take for granted, and we shouldn't do that. So I really, really appreciate you recognizing them. The other thing is just this: as far as the situation is, with superintendents deciding, that maybe they'd rather go remote and on the learning and all that kind of stuff. I hope to goodness that we don't have fragmenting. I understand that we're, that they're challenged by maybe not having, enough staff and whatever. And I surely, absolutely want you to know that on any and every request just about that we have had from the Department of Ed, that we've been able to do anything as far as channeling additional funding, and whether it be for virtual learning or whatever it may be, into our education department and everything, I'm up for. Superintendent Birch is a real star and a guy that really, really cares, super intelligent, a guy that talks right to the point, and he's having constant communications with all these superintendents, and he'll give me advice as to what we really should do and everything with that. But I would also just say just this, in this stimulus package that we are waiting on, and you talk about something that I can get wound up about and really disgusted with, we have been waiting on this for way too long. Way, way, way too long. To be perfectly honest, I know for a fact that our president wanted to get this out the door. And I know for a fact that, like it or not like it, that Nancy Pelosi blocked it and came up with the most ridiculous request you could possibly come up with, because at the end of the day, they probably didn't want to get it out the door. It was a political football that they could play, and to be perfectly honest, they played it well. It's a crying shame, because while they were playing, there were lots and lots of people out there hurting. But when it comes out, I really suspicion that there'll be additional monies, there will be significant additional monies there for testing, and there'll be additional monies there to try to do more and more and more advancements for our schools. If you'll be fair and you'll go back 90 days ago when our president came right out and said he wanted to put I think that was the number, $105 billion into our schools right then to try to do more and more and more that we could to prepare and make our schools more and more and more ready and everything at that point in time. And probably it was in excess of 90 days. The time just flies by. But this, I think, was in August. Well, we just didn't do it. We just didn't do it. But we're going to continue to try to make all the money we can make available. We all know that in class is 1,000 times better for our kids. And we all know that this is a pretty daggum safe atmosphere. And we all know that we've got jobs to do, and I hope we'll go on and do them.
All right, thank you, Matthew. Next to Joe Severino with the Charleston Gazette-Mail.
Hi, everybody. I kind of just want to follow up on Charles Young's question. We're having trouble kind of pinpointing the places where it's most spread. What are the limits to finding that data? And when we do find things like that, why isn't that research being shared publicly? Thank
you. I have no idea, what really you really expect of these phenomenal experts to do. At the end of the day, Bill Kabler asked the question the other day, and said, well, why don't we do this and that and everything? And I would pose the question right back, and just say simply this. If you had the keys to Emerald City here, would you just shut it all down? If you don't shut it all down, really and truly, everybody on the medical team, everybody in the land is telling you this is coming at you from so many different directions. It's unbelievable. You can run to Mineral County and shut the bars down in Mineral County, and the people from Mineral County will go to Jefferson County or wherever it may be. You can go and change hours and everything and restrict, and the bottom line, to every single thing that you change, there's an equal and opposite reaction. If you'll just step back and just be fair and think just about just this. What about the man or the lady that's trying to provide for their family, and all of a sudden, whatever it may be, shut down, and they don't have a job? They are surely uncertain about their unemployment benefits. They can sign up for unemployment and they can get some level of benefit, and Christmas is right around the corner. What about what about the impact on that family? Are they going to be able to buy presents, or are they going to be able to go buy food? What are they going to be able to do? The uncertainty is off the chart. It's tough enough the way it is right now. What about the restaurant owner that you've squeezed and squeezed and squeezed, and they have held on in every way that they can hold on? They've been in business for 75 years. You know, they're an elderly couple. They employ 18 or 20 people, and they have been squeezed beyond belief, and they're just barely hanging on. They've invaded their pension funds, or they've invaded any private monies that they have, or they have even leaned on their bankers to be able to help them. And now everybody's at their wits' end and at the end of the rope. And you say, we're going to shut you down. You know, what's the impact? What's the impact? And what's the impact on knowledge that everyone is available to have the knowledge? Everyone around us is saying, this is coming in so many different directions that absolutely choosing to shut something down over here when there's 50 other ways that this is coming at us probably won't make any significant effect. Now, if it's not going to affect us in a significant way, then absolutely I am adamantly against hurting people in their lives in every way unless it's going to help us. Why in the world am I going to blow my foot off when I have no idea if it's going to help at all? Now, I have told you 1,000 times over, there's no point in really being even disrespectful to our medical experts and all that they do. They're completely transparent. They're doing a whale of a job. They're absolutely, you know, if they come to me and they would advise me and they would tell me, Governor, we truly believe in our heart that here's what we need to do. We need to shut this down, and this will help this amount. Then when have I hesitated? When have I hesitated? That's why I say it's all got to stay on the table. But really, at the end of the day, like it or not like it, not you, not anyone with wisdom would start wholesale just shutting stuff down for the sake of shutting stuff down. To just have some symbolic move of shutting something down and say, well, by God, I shut that down, I shut this down, That's not me. That's not in my makeup. There's no way. All I'm wanting to do is trying to get us through this the very best we possibly can. We will no way be able to eradicate, not today, but with this vaccine, we hope we will. Now, I don't know anything else to tell you. As far as that we're hiding information from you, are you kidding me? Really? You think this is any fun to roll in here and read off 59 names and everything and go through this? We're hiding information from you? Are you kidding me? You know, that is the very last thing that I would permit in any way. So at the end of the day, I'm going to tell you this. I'm going to go to bat for the greatness of, you know, the great Dr. Clay Marsh, the great Dr. Amjad, all the people at DHHR, you know, all the different health agencies, the local health people, as well as all the people across this state. On a national basis, Dr. Fauci, you know, Dr. Birx, all the people that are advising us and have been doing so, all the communications that we have with everybody from all the medical communities everywhere, Johns Hopkins and everything else, I'm going to go with what they say. And that's all there is to it.
All right, thank you, Joe. Governor, I'll turn it back to you.
Well, one of the things I wrote, and I wrote this earlier, you know, and everything, and I think Dr. Amjad was talking, but I said, I wanted to give a really special thanks to all of our experts. That was before the last question. You know, I really, really mean it. From the bottom of my heart, you have been phenomenal. That's all there is to it. and you're dealing with tough dupe. And so all I can say is just, as thankless sometimes as it can be, keep up the great work. You've really done really good. I want to continue to try to encourage and motivate you as best I possibly can, because we still got a long ways to go. The other thing is, during the briefing today, we were advised by the Kanawha County Commissioner President, or Kanawha County Commission President, Kent Carper, that one of the people that was involved in the explosion last night has died. We got a lot to contend with. A lot of these people need your prayers. Really and truly, at the end of the day, these families, these great West Virginians that we lose for whatever the reason may be, they don't really care much about the good numbers. And they don't really care much about, what if they're hurting. So keep them in your prayers. The good Lord will hear your prayers, and the good Lord will make sure that they feel your prayers. So please do that. We're going to get there. I'm too hard-headed to not get there. I've said it over and over, and I'll end by just saying this. I don't regret in any way. I've had so many people, unbelievable, come up to me and say, boy, Governor, gosh, I feel so sorry for you and everything. Jiminy Christmas, what a horrible time to be governor. What an incredibly horrible time to be governor. No governor's ever had to go through anything like this before. What a horrible time to be governor, and they're not right. They're just plain not right. If you've got the right stuff within you, this is the time to be governor. And absolutely, with all in me, this is what I believe God above has placed me here to do. I'll do it with honor. I'll do it with transparency, and we'll get through this. Just hang with me. We're going to get there. Now, thank you with all my soul. God bless you, West Virginia. We're going to get there.